Good morning, everyone. I'm Michael Strom from Oasis Senior Advisors, and this morning I have the pleasure of interviewing Dr. James Lander and Dr. Anastasia Lander from Lander Chiropractic in Brea, California. Good morning.
Good morning.
How are you?
Great.
Good morning. So, before we get started, I was wondering if you two could tell us a little bit about your background of your practice here in Brea.
Absolutely.
Love to.
Wonderful.
Thanks for asking. So back in 2007 is probably when we first met in chiropractic school. I came from an athletic background, and Dr. Anastasia, my wife.
I came from a Wall Street background and decided to go to chiro school.
So there we really started to kind of pass one another, and ultimately we became great friends, best of friends, honestly, for several years, and then eventually kind of got together and got married in 2011.
December 2011.
That's right. And shortly thereafter, we were working for other chiropractors, and we realized that we have such a similar kind of philosophy in how a patient should be treated that we realized what we really need to do is start a practice together versus just keep working for other people.
And therein, in about 2012, is where Lander Chiropractic came from. We were working out of a different office, and we moved into this location, was it 2014?
I think so.
And so our philosophy with working with patients is we like to view as a patient as in terms of the whole body. They might come in with low back pain, knee pain, ankle pain. We want to get them out of pain, but we really want to figure out what's causing the issue. And so it's been great to work with my husband and best friend, and probably the chiropractor I trust the most. He's my chiropractor because we bounce ideas off of each other. We co-manage a lot of patients, and honestly, sometimes a patient wants to see a male, sometimes they want to see a female, and so it's great to have that option for them.
Totally. And even in chiropractic school, our relationship really started with myself having a great respect for her knowledge, and that really continues here where I have a very biomechanical approach to how I look at injury, and then my wife really kind of the same roots of things but has maybe a different approach from the beginning, and then we kind of meet at the end. So there's always this built-in instant referral, instant reference within the office when there's any sort of situation or any sort of injury that maybe we're not quite getting the results we want as quickly as we want them.
And we really try to push patients to understand that if they're waiting till they're in pain, it's almost like they're waiting till that check engine light is on and like the car's not moving. There's so many other things that are going on before that they're in pain that we do treat pain, but we also treat whole body wellness.
Exactly, because most people come in and they seek chiropractic care initially because they are in pain. But truthfully, pain is really only about 10% of the issue. So there's so many things that have contributed to get you to that point. We often use the analogy of a Jenga set where, people come in and say, I was only doing this, I was only doing that. And I ask, gosh, or I point out the point that maybe you've been playing Jenga for the last 20 years and this was just the last little block. So we need to look at posture. We need to look at other things that are happening to your body, physical, chemical, emotional things that have led you to this point. And that's how we actually get the great results we get in this office.
We also have a great support system. We have an acupuncturist that works in this office that also went to school with us. So we've known him for over 10 years, and 2 amazing massage therapists. So the patient can come in and one day need chiro care, one day need acupuncture, one day need massage, or all 3 in one day. But either way, we're going to figure out what they need and help them out.
Well, excellent. So now I was wondering if you could tell us all, what are some of the different types of chiropractic services you offer?
Sure, we could definitely cover that. So I'd love to answer that. In this office, Dr. Anastasia and I both have certifications in Webster Technique, which is for pregnant women. It's a specialty certification for that. We are also both certified in Graston Technique and kinesiotaping, but we also have other modalities that can be quite common to chiropractic offices, from ultrasound to muscle stimulation, and all of those things really come down to what that patient needs. And other techniques or modalities or services that we do use are corrective exercise. We may be giving a specific stretch or an exercise to correct one's posture and work towards that person's overall well-being and health.
And of course, we offer adjustments. We do manual adjustments where we align the spine and make sure that all the joints are moving the way they're supposed to.
Wonderful. Thank you for all that information. Now, I have always had the misconception that chiropractic services were usually just for young adults, but I've now found out that it's a much more expansive age range that you guys can address services for. Can you talk about the different age ranges and treatments you can give to different age groups?
I'm so glad you asked that question. Absolutely.
So in this office, we see patients from all ages and abilities.
Our youngest patient, we see them right after birth. Moms and dads bring in their babies right after they deliver them, and our oldest patient is in their 90s.
Yeah, and that older population, it's really important to understand that it's really about working with them to get the highest quality of life for as long as we have it. We see patients that have everything from dietary issues to obviously movement issues and pain and mobility issues, and we want to make sure that they're functioning at the highest possible level so they can do whatever it is they want to do. And I really mean that athletically, because although we do see some high-level athletes in this office, we look at our patients as, everybody we kind of treat the same as all ages and abilities, because whatever that senior citizen wants to accomplish, we want to allow them to do that. And the truth is, as long as you use your body right, you can do those things. So we really try to respect that in our treatments.
Well, excellent, you guys. Thank you for that explanation on those different types of services for the different age ranges. So now can we talk about what type of different payment arrangements and options do patients have when they need chiropractic services from you?
Sure, we can cover that. In our office, we have very competitive cash rates.
However, we do accept most PPOs and Medicare, and the best way to find out is give us a call and let us verify your benefits, because we need to find out if we're a network, if you have coverage, or if you need a referral.
Well, thank you for telling us all about Lander Chiropractic. So I have a question. As far as if clients would like to come by, what are the days of operation that you actually accept clients?
We're here Monday through Saturday, and our hours vary depending on the day. We do have a few days where we're here till 7 o'clock.
Wonderful. And as far as your location, where are you located when they want to stop by for an appointment?
We're at 1203 West Imperial Highway in Brea, and it's on the corner of Puente and Imperial.
Great. And as far as a phone number for appointments, what's the best phone number to reach you guys at?
714-626-0074. But we also have a cell phone, so you can reach us at 714-931-0475 to send a text.
Wonderful. And if clients would like to find out more information about your practice in general, what is your website?
You can visit us at landerchiropractic.com.
Excellent. Well, I really appreciate your time. Thank you very much.
Thank you.
Thank you.
Thank you so much.
Bye, everybody.
Bye.